Now, can everyone read this in the back? This is you can't even read this up front, all right? But this is a life expectancy chart, okay? The United States has the best doctors, the best medical system, the best pharmaceuticals, the best access, blah, 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 blah. So why is it that life expectancy, we're number 51 on this list? Number 51. All the money we spend, like more than just about every other country combined on their health care, and we're having all kinds of health issues that are just going unresolved, okay? Now, my friends from the China and the China study, they're somewhere in the 80s over here, so maybe the China study isn't everything, but I just want to talk about a couple things to once again highlight the American medical system, all right? Here we talk about arthroscopic surgery versus sham surgery for degenerative meniscal tears. So people who have basically a bum knee, all right, they go for arthroscopic surgery where they actually do something versus a sham where they go in there, they put the scope into the knee, and they don't do anything. This procedure occurs over 1 million times a year in this country, and this study showed the outcomes after the surgery were no better than those who had the sham procedure. This is in the New England Journal of Medicine. This is not in the Journal of the Crazy Cardiologist. This is in the New England Journal of Medicine, the biggest journal in the world. Okay? So this is what's going on, and it's still going on, and we'll see if anything really changes because of that. Here we got some data on all the people that are taking non-steroidal anti-inflammatories, ibuprofen, Advil, Motrin, etc. It's responsible for 15 deaths out of every 100,000 people, the same chances of dying in a car accident. All right, now most of us, or some people in the audience certainly, do both. Now that makes you 30 out of 100,000. There are natural ways for everything. Just about everything. We'll talk about that. 2,500 medical or surgical treatments. All right, this is from 2007. This is just random surgeries, whether it be removing your gallbladder or angiograms, kind of all comers in this study. All right, this is from British Medical Journal. 46% were of unknown effectiveness. All right, only 13% were thought to be beneficial, and a sizable portion here was actually shown to be harmful. Now, if I say this word here, cholesterol, so let's get to the meat of the talk right now. If I say the word cholesterol, what immediately comes to mind? Bad stuff, right? Bad stuff comes to mind. Maybe some older folks in the audience know who this actress is. I don't know, but she's doing a good job of being scared. All right? I think she's running from the Blob or whatever from 1952. So what is cholesterol? Well, this is a scientific interpretation of what cholesterol looks like. This is what we learn in chemistry. And what I want to tell you is that there's 3 atoms that totally make up this molecule: carbon, oxygen, and hydrogen. Oxygen is the most common atom or element in the human body. Carbon is number 2. As you can see here, there's no poison in this molecule. There's no heavy metals in this molecule. There's no BPA or plastics or anything else in this molecule. Now this is a depiction of a cell. And the cell, of which we have trillions, houses all the internal functions of that cell, and it's encased in something called a cell membrane. All right? Cell membrane is important to keep things inside the cell that belong inside and keep things outside of the cell that do not belong. Having a healthy cell membrane is very important. Well, what do you think is a large part of the cell membrane? Cholesterol. And cholesterol are these little dots right here. Cells communicate by talking to each other, and this is all part of where cholesterol helps with these membranes. Okay? Here we have an example of cholesterol and the importance of hormones. All right? This is Mr. and Mrs. Lyon from down the street. All right? Cholesterol makes testosterone. It makes estrogen. It makes progesterone. It makes aldosterone. It makes the energy hormone cortisol. Does anyone think that that stuff is important? Once again, whoever put us together gave us cholesterol for a reason. Every animal species has cholesterol. Eggs contain cholesterol because that's how a chicken comes to life, by eating the yolk. Here's a picture of our digestive tract. All right? The liver makes cholesterol, dumps it into the gallbladder, if you're still lucky to have yours, lucky enough to have yours. The gallbladder then squeezes the cholesterol in the form of bile onto your food, digests the food, and then later on comes back into your recirculation or it goes out the other end. So cholesterol is part of the digestive tract. Here's our friend vitamin D, okay? Sunshine is one of the sources of life, okay? Sunshine is absolutely necessary. Any information that says that sunshine causes cancer is laughable. Sun is necessary. Nothing grows without the sun. So how does cholesterol, how does vitamin D form? Well, vitamin D, of course, is the sunshine hormone, and it is a hormone. Cholesterol is coursing through the skin. Sunshine hits it, turns the cholesterol into vitamin D. Coursing through the skin, sunshine hits it, and now it's vitamin D. Sounds like cholesterol is pretty important, right? And we sure want to lower it down. And here's a beautiful picture of a baby feeding. What is inside? Breast milk. Cholesterol, and a lot of it. Why does cow's milk have cholesterol when it's whole milk? Because that's what a baby cow needs. A human being needs breast milk that has saturated fat and cholesterol that's inside there. Very important. And once again, would Mother Nature give that to a mother to intoxicate or to harm her child? All right. Well, doesn't cholesterol cause heart attacks? I've heard this for so many years. What are you talking about? Yes, I understand it's important, but isn't it causing heart attacks, right? We got this heart here that's just swimming in a sea of cholesterol. Well, here's a study from the Framingham Trial, which is one of the largest trials, actually the largest population-based trial that's ever been performed. And this was reported in the American Journal of Cardiology over 15 years ago. And we can see basically all we need to know from this is that there are two curves. They look pretty similar. One curve represents people that have heart disease, and the other curve represents people that don't. And we can see that they're basically the same curve. The higher the levels are, you had as much of a chance of having heart disease as if you did not. Here's a trial that was done, and this was a trial that I'll be talking about in a little bit. But nonetheless, what it says here, a 5-year study of LDL. If LDL was less than 142, event rate was 5%. If it was 143 to 156, event rate was 4.8. If the LDL was above 157, the event rate was 7%. So a little bit higher. A little bit higher, 2% higher. But the pharmaceuticals get a hold of this, and they tell the insurance companies and the government, and they're all excited about this information, and they make that 2%, they twist around the data a little bit, and they say, oh, it's 20% difference. But here's the actual number, 2%, okay, after 5 years. But there was no difference in life or death. That was a 2% difference in events, but not in life or death, which is obviously very important. And here's how I put it on my graph to really show you there's not too much difference between these two curves. This is from a quote from Michael DeBakey in the 1970s. Michael DeBakey was the most famous cardiovascular surgeon of all time, one of the innovators of countless procedures, died at the age of 96 a couple years ago. An analysis of cholesterol values in 1,700 patients with coronary disease revealed no definite correlation between serum cholesterol levels and the nature and extent of coronary disease. That's coming right from him. LDL, low-density lipoprotein, you must be the boogeyman, right? LDL is the bad cholesterol. Once again, every animal species makes LDL. It is there for a reason. All right? This is an LDL molecule that's floating around through the body, and the LDL contains cholesterol to do all the things that we talked about. The LDL also contains triglycerides, which are dropped off around the body for energy. Okay? It also carries fat-soluble vitamins and also carries CoQ10. LDL is the bus that is manufactured in the liver and drops off the passengers, cholesterol, triglycerides, vitamins, CoQ10, where they're needed. So when the testes want to make more testosterone, they call out to the liver and say, send down more cholesterol. The LDL bus takes off, drops off the passengers to the testes where it can make more testosterone. This intricate system from Mother Nature is pretty darn good. Okay? Some would say pretty close to perfect until we started to mess with it. All right? An interesting fact that I assure you, the average doctor, the average cardiologist, except for Dr. Khan, know that LDL and HDL are important in fighting infections. They bind to bacteria, viruses, fungi, parasites. They have a role in the immune system. This is just starting to come to light. Now, one thing that I test for in my office, I test for what's called LDL particle size. And this is where you can get some of the good and some of the bad information. So out of the LDLs, there are good ones, which are the large, buoyant, fluffy LDLs, and there are the bad ones, the small, dense LDLs. The large ones just kind of float around the bloodstream, dropping off its passengers, doing what it needs to do. The small ones circulate around the body. They are like BBs that just go right through the blood vessel lining and wreak havoc, and certainly increase risk of cardiovascular disease. Those small ones are not picked up by the liver, as opposed to the large ones that are. They're not cleared from the body. They're also prone to what's called oxidative damage. They get damaged very easily. So we don't want too many of those small ones that are floating around the body. The large ones, like I said, they have their benefits of what they do. And once again, the issue that leads to small, dense particles, the same issue that leads to everything. And this is real simple for anybody to remember. Two things cause disease: poor nutrition and chemicals. Plain and simple, that's all of it. You can take a family with a certain genetics, but something has to trigger the genes. Poor nutrition and chemicals trigger the genes. Now we all remember this gentleman here, Tim Russert. Tim Russert was on statins. He was on Lipitor. His lipids were apparently well controlled as far as his total cholesterol, but what he had was a lot of particles. And when you have a lot of particles, especially those small little guys, they get into the blood vessel and they cause damage. So if cholesterol does not cause heart attacks, it must be the fat in my diet, right? It must be the avocado. It must be these almonds here that are loaded with fat, all right? Well, here's something called the low-fat theory that was invented in the early 60s. And on Time magazine, on the bottom left here, this is a picture of Dr. Ansel Keys. And Dr. Ansel Keys did a study, and on the left here, we can see that there's what's called the 7 countries study. And what he postulated was that the more fat you took in, the more risk of cardiovascular disease. But then other doctors came along and other researchers came along, and they put in a list of 22 countries, and we can see how the graph starts to get muddied a little bit. We can see that, down over here, okay, 8, which is France. France has a high consumption of fat, but they have a low incidence of cardiovascular disease. And we can see right up here, for example, that's Israel. They have a lower intake of fat, yet they have a higher risk of cardiovascular disease. The French issue was often called the French paradox. There really is no paradox. Okay, the French eat fat, and fat's not the problem. Here's a meta-analysis from the American Journal of Clinical Nutrition, the biggest nutrition journal in the world. Okay? They looked at 350,000 people in this study. That's a large number of people. And what was their conclusion? Saturated fat has no association with cardiovascular disease. Get that? So when the doctor says to you, cut out your saturated fat, say, hey, what about that analysis of 350,000 patients that said no association with cardiovascular disease? Once again, saturated fat is in breast milk. How bad can that be? All right? Fat and risk of stroke. They looked at Japanese men, 44,000 men. No evidence was found that the amount or type of dietary fat affects the risk of stroke. Fat is not the problem. And here's a saturated fat called coconut oil. There's populations in the South Pacific that live on coconuts and coconut oil and coconut products, and they all smoke. And nobody has disease. They're incredibly healthy. Why? Because they're eating their native foods. Coconut oil is absolutely tremendous. It's tremendous to cook with. It's tremendous to bake with. It's great to put on your skin. It's a great alternative to aftershave. And a lot of good benefits to the use of coconut oil. There are old guys and there are fat guys. There aren't many old fat guys. And I mean no disrespect, obviously, to James Gandolfini and to Tim Russert, but they were a couple fat guys. And as a medical doctor, like I said, there's not too many old fat people that are walking around. Remember this guy, Gene Wilder? Of course you do. So this is Willy Wonka and the Chocolate Factory. The real villain is sugar. Sugar is the problem, okay? Diabetes, increased risk of coronary disease, increased risk of stroke, increased risk of erectile dysfunction, increased risk of kidney disease, dementia, and there's a lot of data that says that sugar consumption increases risk of cancer. Now, diabetes is kind of an interesting thing because it's just a label, and doctors are great at putting labels on things. So if your blood sugar fasting is 126, then you're labeled with diabetes. But what about if your fasting blood sugar is 125? You're not diabetic. But isn't the risk just about the same? It's a little bit, I'm not diabetic yet, so I'm okay. The reality is that this is a line that is straight up. And for every point that your sugar goes higher, your cardiovascular risk increases. And here's from the Spanish journal in 2009 that tells us here that if you are labeled as someone who is pre-diabetic, your risk of a cardiovascular event, in this case actually the risk of dying, was 60% greater, 60, if you're labeled with pre-diabetes. If you are labeled with diabetes, your risk was 250% greater. Diabetes is not something you want to get. You don't want to be anywhere near labeled with diabetes or pre-diabetic. You want to have normal blood sugar. You can eat sat fat all day long. You can go home and drink a bottle of olive oil and your blood sugar will not budge. You can have a dozen eggs and your blood sugar will not budge. But you go home and you eat a piece of wheat bread, it goes up. All right? One common blood test we do is called hemoglobin A1C. And hemoglobin A1C is a long-term measure over 3 to 4 months of blood sugar control, as Dr. Kahn was saying, what's called a glycosylated hemoglobin, or something that basically has a normal molecule, hemoglobin, but now there's a sugar attached to it, and that is a sign, and in and of itself maybe is certainly damaging to the protein that it's attached to. 4 times the risk of death, 2 times the risk of cancer, 3 times the risk of cardiovascular disease. Okay, smoking is only 3 times the risk of death. So having diabetes is worse of a diagnosis than if you're a smoker. Okay, and obviously the two of them, together are certainly problematic. I think the way I've been talking almost sounds like I'm promoting smoking, but I certainly am not. Now here, for my Chicago friends in the audience, here's a nice picture of a deep dish pizza. It does look very good, and I didn't have lunch, so even that looks tempting to me. Nonetheless, insulin, fasting insulin levels. Very easily test on blood work these days. Subjects who had elevated fasting insulin levels had a 31% increased risk of heart attack or stroke. So your blood sugar may be perfect. It may be 80 fasting. Your blood sugar may be 85. It may be 75. It may be perfect. But if your body is struggling to keep that under control by using a lot of insulin, insulin itself is toxic to blood vessels. All right, so who do you want to be? You want to be this guy here with the beer belly? To me, it's just a carb belly. Or you want to be these people on the right over here from the TV show Survivor that are walking around eating twigs and berries and maybe. I gotta say, maybe the guy on the left actually looks a little more content than the people on the right too. The Japanese eat less fat, they have less heart disease. The French eat more fat, they have less heart disease. The Italians drink more wine, have less heart disease. The Spanish drink less wine, have less heart disease. Maybe speaking English causes heart disease. So, those of you that know me know that I am a big believer in paleo, and paleo diet is really not the right word. Paleo is certainly getting a lot of publicity these days. Paleo, it's about paleo nutrition, paleo lifestyle. It's about what our ancestors did for millions of years before we got into the trouble that we're in today. All right? So obviously we've got our vegetables, we've got our nuts and seeds, we've got our wild meats, our coconut and olive oil. There's two things that are extremely important that I certainly tell people. Everything should always be organic. No matter what you do when you leave here today, stay organic. Because even if you say, you know what, it's Sunday night, we're going to watch 60 Minutes and we're going to have our weekly ice cream load, just go to a place like Whole Foods or Trader Joe's or Sprouts or your natural grocer and get organic ice cream. Now, I'm not promoting this, obviously, but if you're going to do it, get something that has the flavor that you love, the sugar you love, the dairy you love, but none of the chemicals. The chemicals make a big, big difference. And just getting that one simple thing out of your life. If you're a coffee drinker, and I'm not in favor of coffee consumption, I was, basically, born and raised on coffee. My father, when he would take off, for work in the morning, he's drinking coffee. Hey, Pop, can I have some coffee? Yeah, sure, have some coffee. And you'll find pluses and minuses about coffee. Coffee simply is not paleo food. But if you're going to drink it, just get organic coffee because there's some poor Colombian, Nicaraguan, Honduran that's spraying pesticides all over the crops. And if it's killing the bugs, it's going to kill us. If it damages the neurologic nervous system of a bug, it will damage our neurologic nervous system. It's so easy to make that one simple change, and that's also a good way to kind of, pass that on to other people, to tell them to, make that one simple change, okay? Red meat consumption and risk of incident coronary disease, stroke, and diabetes, right? These lions in Africa, they're all over there dropping dead because they're eating meat, all right? This is from Circulation, another huge cardiovascular journal. No increased risk with red meat consumption. Now, I do realize we are not lions and tigers, but we can go on about this, and this is not meant to be a paleo lecture by any means, but Eskimos eat tons of red meat, and plenty of them are in good shape. Sorry once again for the small print here. People ask me all the time, meat and cancer risk. Okay, this is from the journal Cancer Causes in 2010. Meat and colorectal cancer risk. Little evidence of association between consumption of red and processed meat and colorectal cancer risk. When I'm talking about meat, I'm talking about free-range, grass-fed, healthy animal products that were not corn-fed, soy-fed, injected with hormones and antibiotics. I'm talking about healthy meat that would hopefully be as close as possible to what our ancestors would have consumed. And I personally think that, although it will never be done, if you were to do a study and you were to include those healthy meats, you will not find the problems that when they do these large studies and they're checking, they're identifying those people that are eating toxic hormone chemical meat. And it's going to lead to health problems. Beneficial effects of a paleo diet on cardiovascular risk factors in people with diabetes. Over a 3-month period, a paleo diet improved glycemic control, blood sugar control, and several cardiovascular risk factors compared to a diabetes diet. The Diabetes Association, the Food Pyramid, etc., they've been promoting this diet, their diet for years, the diabetes diet, and it's a sham. It is only there to perpetuate sickness, perpetuate illness, and there may be some evil people out there that realize this, and they just don't care. They just want the money. Here's the supplement facts of an egg. An egg is like a multivitamin. Like I said, it's a cocoon for a baby chicken. And actually, here's a picture of my son Noah in front of our chicken coop in our backyard. And this has been a tremendous thing for us. It's absolutely phenomenal to be able to go in your backyard and see the chickens, see them running around, and hopefully soon enough producing some very healthy eggs for us. They will be healthy eggs like the world has never seen. Now this is a patient of mine, 30-year-old male patient with a family history of heart disease. Nonetheless here, this is before and this is after I institute nutrition and supplements. The big thing here, we increased his HDL by about 35%. We can see it here. We can see it in this area right here. And then a marker of inflammation called CRP went from 1.4 to 0.7. We dropped his levels in half. Not bad, okay? There are no pharmaceuticals that can raise HDL like that. Nothing on the market. 38-year-old male with reflux, and he's overweight. His LDL particles, which I said were very important, the particle number, went from over 2,500 down to 1,400. Tremendous movement. We dropped his LDL cholesterol from 186 down to 128. We dropped his inflammation from 1.7 down to 1.1, almost into the normal range. This is, absolutely tremendous on what nutrition and what supplements can do, and certainly without side effects. Here's a 70-year-old female with diabetes and, quote, can't lose weight. Well, when I tell someone about paleo nutrition and they follow the program, they lose weight every single time. Paleo is what bodybuilders do. It's what fighters use to cut weight. Those are the foods that they're eating. And what was interesting here is that this is a marker, this is a blood sugar analysis. We dropped the hemoglobin A1C from 7.2 down to 5.9. We dropped the insulin level from 16 down to 7. Okay, pretty impressive movements in a short period of time. So once again, if you're going to debate veganism, or you're going to talk about, the China study or engine number 2 or whatever the latest fad diet is, there are universal food laws which I think are certainly very important. Eat organic, say no to GMO, genetically modified foods, the ramifications of which are horrific, and more will come to light as time goes on. No processed sugar. Know the source of your food. Go to farmers markets. Meet the farmer. This company that's outside here, Farmyard, it's absolutely amazing. You're talking to a suburban Chicago kid whose father was a doctor, and then you walk up to this house and their front lawn is a farm where they've got the most beautiful produce that's growing. It's absolutely incredible. So when I was planning this conference, I called them up and said, you guys got to get here. You guys got to get here to be able to talk to this group of people, to be available and let them know that you exist. farmers markets all over the valley. The more we support people like that, the more we support the organic farmer, the more there's going to be of those farmers, the cheaper the food will become. Raw 2/3, cooked 1/3, don't overeat, nothing artificial, no electronics at the dinner table. I can be as guilty of this as anybody else, but just sitting there with your cell phone or your iPad and all these things, it just interferes with the whole communal aspect of dinner was supposed to be like. Okay? Limit fluids around meals. People with heartburn, indigestion. When you drink a lot of fluid around the time of a meal, it interferes with your digestion. It dilutes your stomach acid, dilutes the enzymes that break down food, and therefore you have heartburn. So try and space it, like I said, try and avoid liquids an hour before a meal, a half hour before a meal, and for a couple hours afterwards. Don't go choke on your food. You can wash it down a little bit, but this whole idea of filling up your stomach with liquids and you won't eat as much, it's not true. Never been proven. A few words about family history, okay? Look at this family, all right? Is genetics their problem here? Okay, it's definitely not a genetic issue, all right? This family, they're sitting there, they're eating all their, they're watching TV, they're eating their ice cream, okay, right in front of the television set. This is what the problem is. If you take any particular family, and one family has breast cancer in it, another family has cardiovascular disease, another family has dementia, another family has all three of those things all combined. It's poor nutrition and chemicals that lead to activating that disease. It is not the genetics. There's 300 million people in this country, over half of which have cardiovascular disease. Do they all have bad genetics? You cannot blame the family members. People come in my office for years, I got a family history. Well, everybody's got a family history of just about everything. They got cancer in their family, they got heart disease, they got dementia. Everybody's got something in their family. Stop blaming the family and start taking control. Now this is some people sitting on top of South Mountain looking out into the mist of Phoenix. I don't know why I said mist. I'll just say, just absolute total poison that's there in Phoenix. The particulates in the air, the pollution that's in the air causes cardiovascular disease. Causes every other disease. But I'm a cardiologist. I'm here to talk about cardiovascular disease. And this is a problem. All the pollution that's in the air. Long-term exposure, this is from British Medical Journal, January 21st, 2014. Long-term exposure to particulate matter is associated with incidence of coronary events. Everyone know this guy, this show Man vs. Food and Adam Richman? For us people that are on the paleo nutrition plan, my wife and my two boys, we lay in bed and we watch the show, and frankly, we kind of fantasize about some of these foods that this guy's eating. I will be honest. All right? And this is the mentality. I'll just pop a Lipitor and eat whatever I want. And I used to think that way. Well, here's from that trial again, AF caps, TEX caps. All right, now pay attention. This is the part where I really start bashing statins. And Joel's out of the room so I can do it safely. All right, average follow-up 5 years. Primary prevention, so people that have never had a cardiovascular event. Study was published in JAMA, biggest journal in the world. There's the cholesterol levels, and they get statin versus placebo. No difference in life or death after 5 years. Some of the endpoints were a little minuscule better in the statin group, but yet life or death, no difference. Okay? The evidence on statins saving lives for primary prevention is not existent. At the worst. At the best, it's controversial. No difference in women in any of the endpoints. There weren't many women in that study. Women are not often studied. But here's a study that did include women, primary prevention. They looked at them for 3 years. Stroke death was actually higher in the statin group. Heart disease death was higher in the placebo group, but look at these numbers, 4.2 versus 3.3%. These are small differences from drugs that cost gazillions of dollars. Cancer death was higher in the statin group, Total mortality, life and death, no difference. This is the gentleman who was the former CEO of Pfizer. And in the bottom here, this is actually his exit package, total $205 million. I do have a pharmaceutical CEO in my practice, a retired CEO in my practice of a pharmaceutical company. And I talked to him about this, and I showed him some of these things, and he just sat there and didn't say a word. Blood tests that really matter, okay? The typical blood test your cardiologist runs, your doctor runs, total cholesterol, LDL, HDL, triglycerides, those are 1970s technology. Those were invented when disco was popular. A company like HD Labs, which I use in my office, and they're also represented here today, they do an amazing blood panel, and this is the kind of stuff that a natural cardiologist runs on his patients to get to the actual cause, to come up with some good, hard data. Because so many times I've seen patients and they'll say, well, I went to my doctor and they said, all my numbers look fine. Well, they checked 4 numbers that are antiquated. There's so much more we can know to dive into the truth, and then you put them on a treatment program, and then you remeasure that 3 months down the road, 6 months down the road, and you see what the difference is. And I just showed you on 3 of my patients the difference. Things like LDL particles, insulin, inflammation, oxidation, which is another sign of damage to blood vessels and to products, food sensitivity testing, looking at micronutrients, methylation and genetic defects, homocysteine levels, cellular levels of omega-3. Are you taking enough? Are you taking too little? Are you taking the right product? Okay, that's why you need, whether it's myself or a skilled naturopath or someone who's skilled in the natural realm, skilled homeopath, okay, skilled chiropractor that is used to dealing with this stuff. There are some good doctors out there to help guide you in your quest for better health. Heavy metal toxicity, and then autoimmune panel. All these people with thyroid disease, Hashimoto's. The body is attacking itself. It's causing arthritis. It's causing any kind of label you want to put on stuff. It's all, once again, it's labels for poor nutrition and chemicals. But we can measure these things. Dr. Khan talked about multivitamins. Somebody come up to me, and maybe somebody from Mayo Clinic is, oh, did you see the latest study of multivitamins don't work? Well, the garbage multivitamin doesn't work, although Centrum, a year ago, there was a study that was published using Centrum, cut cancer risk by 9% versus the placebo. This one just came out in the American Journal of Clinical Nutrition. Multivitamin use elongates telomeres in women. Telomeres are a measure of aging. The longer the telomeres, the better. And this one showed that women who took multivitamins may have added 9.8 years to their life versus those who don't. Pretty compelling data. Okay, here's a list of supplements. Take this down real quick. All right, on the bottom left, I got my new product, Cardio Superfood, and the right is Cardio Green. But these are just everything on this list. Everything up here is evidence-based. Everything has science behind it. Do I have a study comparing a natural blood thinner like nattokinase and vitamin E and vitamin C compared to a blood thinner like Plavix or Pradaxa or warfarin? I don't have that study. It's never going to happen. Okay? But I do know that the stuff I do is not harmful. Finally, here I want to talk about something called chemtrails. This is in the Phoenix sky. All right? What are chemical trails or chemtrails? This is what is dumped out of a plane. And why is it being dumped is anybody's guess. Okay? Chemicals and heavy metals dumped from planes. Is it there to control the weather? Is it there to control the soil? Worst case scenario is someone deliberately trying to poison us, so we have to take their drugs. This gets out there pretty conspiracy, and I understand that, but I tell you something, look up into the Phoenix sky when you wake up in the morning and the sky is clear. And then the chemtrails start coming in, and then by the afternoon, the sky is cloudy. Just observe that every day, and you will see what is going on in our city and around the world, and start to ask questions about what it is. And there are people in this audience and people you will meet that are exquisitely sensitive, and they know they felt well in the morning, and then in the afternoon they felt lousy because their breathing changed. When I test heavy metals on people, and you look at some bizarre things like barium and thallium and thorium, where is that coming from in people's bodies? It is being dumped on us. It's in our food supply. It's in our water system, okay? And this is why you take supplements. Because even on the best diets, as Dr. Khan also mentioned, the best diets are still deficient in these nutrients, and we are all so toxic, we need better than the best diet. We need the supplements to get the poisons out of our body. And that is my paleo family. And once again, I thank you all so much for being here. Thank you.